If you're a veteran who served in Vietnam or other areas where Agent Orange was used, this video is for you. And if you've later developed skin cancer, which I hope you have not, but if you have, you may be wondering whether there's a connection and if you qualify for VA disability benefits. You might, right? Although skin cancer isn't currently on the VA's list of presumptive conditions related to Agent Orange, research does suggest a potential link between herbicide exposure and certain types of skin cancer. What does this mean? It means that you may still qualify for VA compensation, but you'll need strong evidence to support your claim. I'm going to break down what you need in this video, okay? So, skin cancer can be caused or aggravated by exposure to toxic herbicides, Agent Orange, used during your military service. The VA recognizes certain types of skin cancer, basal, squamous cell, melanoma, and which can develop because of Agent Orange exposure. Although the VA doesn't consider skin cancer caused by Agent Orange exposure a presumptive condition, studies indicate that there may be a link between certain types of skin cancer and the toxic herbicide. So, you, the veteran, must establish a direct connection between your skin cancer and military service to qualify for skin cancer disability. What is Agent Orange? I don't want to insult anybody's intelligence, but it was a blend of tactical toxic herbicides used by the U.S. military during the Vietnam War to defoliate trees and plants, clearing out dense tropical foliage in Vietnam, overgrowth in the combat areas from 1962 to 1971. While there were over 19 million gallons of various rainbow herbicide combinations used in Vietnam, the type that was used most often was called Agent Orange, and it got its name from its recognizable orange label on the 55-gallon drum in which the herbicide was stored, right? Agent Orange was heavily sprayed in certain areas, including near the demarcation zone in forests at the junction of the borders of Cambodia, Laos, and South Vietnam, in the mangroves on the southwest peninsula of Vietnam, and along shipping channels southeast of Saigon. Unlikely a commercially sold product, Agent Orange was developed specifically for the military and was not tested for safety on humans. Agent Orange has harmful chemicals called dioxins that have been linked with many health conditions, including Parkinson's disease, type 2 diabetes, peripheral neuropathy, skin cancer, and more. If you're a veteran who served in these specific areas during these certain time spans where Agent Orange was used or handled and may have been exposed, you may be eligible for VA disability compensation. Okay. Skin cancer. What is it? The most common type of cancer in the US occurs when skin cells begin to grow uncontrollably, resulting in symptoms such as new skin growths, rough patches on the skin, sores that don't heal, unusual changes in moles. So, early detection of skin cancer is essential to successful treatment, especially for melanoma, which can be absolutely aggressive and potentially life threatening. I hope that's not you. The types of skin cancers: melanoma, non melanoma, basal cell carcinoma, squamous cell carcinoma, okay, also known as SCC. Melanoma, basal carcinoma, squamous cell carcinoma, SCC, are not recognized by the VA as presumptive conditions related to Agent Orange exposure for Vietnam era veterans, unfortunately. However, studies have shown that Agent Orange exposure may be linked with skin cancer. Veterans diagnosed with skin cancer must provide medical evidence establishing basically a direct connection between your condition, and I hope that's not you, but if it is your condition in military service to qualify for disability compensation. Scientific studies that report a link or a nexus between certain types of cancer and Agent Orange exposure can be used to strengthen your VA disability claim. That's very important, okay? Basically, some examples of some affirmative studies are a study published in JAMA Surgery, which revealed that veterans with Agent Orange exposure have a higher risk of melanoma than the general population. A study published in JAMA Surgery discovered that veterans who sprayed Agent Orange herbicides in Vietnam showed a higher than average rate of basal cell carcinoma. These links to these studies are in the description of this video. You can use it as evidence. A 2020 study found a link between veterans exposed to Agent Orange and squamous cell carcinoma, right? So for more details, stay up to date on these videos so that you understand what Agent Orange exposure is, presumptive conditions, ineligibility as things continue to change. Very important. If you're a veteran with skin cancer that may be linked to Agent Orange exposure, understand that you may qualify for benefits, and you need to understand the VA's rating system. It's crucial. There's no specific diagnostic code for skin cancer. Rather, it's rated under the VA's rating table, 4.118 of schedule ratings of skin, and they assign disability ratings from 0 to 100%, depending on the following factors: a VA disability rating of 100%. The 100% VA rating continues for 6 months after active treatment ends. After active cancer treatment ends, a reevaluation is conducted by the VA, and any residual conditions such as disfigurement, scarring, or functional impairments are rated under DC 7818 and 7833, ranging from 10 to 80%, depending on the severity of residual conditions. Okay, so the VA outlines specific diagnostic codes for skin conditions, very important to understand. Diagnostic code 7818 veterans, malignant skin neoplasms, diagnostic code 7800, which is disfigurement of the head, face, or neck, and diagnostic code 7801 to 7805, which are scars. Okay, you can get rated for scars as well. Again, everything is with cancer. Is it active? Is it not active? Is it in remission or not? If it is, then you can go up to 100% rating. If it goes into remission, they can reduce you down and reevaluate you again every 6 months. Okay, very important. To establish service connection for skin cancer, you need a current medical diagnosis, service record, a nexus if you do need that, lay evidence, claim submission, and Agent Orange exposure, right? Basically, this would include documentation of service and locations and timeframes linked with Agent Orange exposure. So basically, DD-214 showing service in Vietnam, or including its inland waterways in 12 nautical mile territorial seas, Laos, or Cambodia, military deployment from January 9, 1962 to May 7th, 1975, and other qualifying service location and timeframes. Okay. You can also do secondary conditions to and from skin cancer. Okay. Very, very important. You could do mental health ratings, major depressive disorder, generalized anxiety disorder, unspecified anxiety disorder. However, to secondary something, you need a nexus, DBQ diagnosis. If you have sleep disturbances, you could file that as well too. Obstructive sleep apnea under diagnostic code 6847 is evaluated by the VA under diagnostic code, again, 6847. That's for sleep apnea, rated that, but the ratings range from 0 to 100%. And you could get something based on symptoms and treatments, etc., such as whether you require a CPAP or not, or a device that keeps the airway open during sleep. But again, as I've stated in other videos, there may be upcoming changes for the VA ratings for sleep apnea. So again, the VA does not automatically presume skin cancer, but you need to understand that you do have a path forward. If you've been diagnosed with skin cancer and were exposed to Agent Orange during your service, it's critical that you understand what you may be entitled to. You need to gather strong medical evidence, and you need to build a claim that stands up with the medical evidence backing it to the VA's requirements. If you need a nexus letter, reach out. We can point you in the right direction. You do not have to be alone in this. Continue to fight with the right evidence, documentation, support. You can secure maybe the VA disability compensation that you do have and have served and deserve and have earned. So thank you for your service. Thank you for tuning in. I hope you don't have cancer, but if you do, or you know someone that does, I hope this video can help them help them out. Again, thank you for your service. Thank you for tuning in. We're going to keep pumping out videos to help you so that you guys are in the best position. Thank you so much. Y'all have a good day.